Assalamualaikum and hi. My name is Wan Amirul Yusri bin Wan Ahmad. Today I will collaborate with Nur Hidayatul Rahimah for present about computed tomography CT scan, one of the application X-ray spectroscopy in industry. Okay, as you can see, this is our poster created from our group. By reading this, you can easily understand about the CT scan. There are a few parts we highlight such as introduction, significant techniques, comparison, and conclusion. Okay, we will go through into the slide presentation for more explanation. The introduction. The word tomography is from the Greek tom, means slice, and graphing to write. Computed tomography was originally known as the EMI scan and developed in 1970. The developer of CT scan is Alan M. Cormack and Godfrey N. Housefield, which one of the awarded Nobel Prize in Physiology or Medicine in 1979. A computed tomography scan, CT or CAT scan, uses computers and rotating X-ray machine to create cross-sectional image of the body. This image provides more detailed information than normal X-ray image. It has been widely used in medicals for screening the tumor, full motion hurt, and bone trauma. Sometimes we can find this in airport security for scanning the TNT or something that's not illegal, and artifact scan. There are two types of CT scan. First is the spiral CT scan, which is familiar for us. The second is electron beam tomography. Electron beam tomography specific for heart disease. Okay, let's go through. Next is the significant techniques or how it works. First, the X-ray tube, you will shot the photon beams through the body. And then, the special digital X-ray detector will pick up the photon beam and transmit it to a computer. The CT computer uses sophisticated mathematical technique to construct a 2D image slice. And then, this process will be repeated until the desired number collected. Next, the reconstruction of 3D visualization image. And lastly, the observation of skeleton, organs, tissue, as well as any abnormalities the physician is trying to identify. Okay, by observing the two images below, the first one is electron beam tomography, which is used to observe the heart disease, and the detector is not moving. For the second is spiral CT, which the patient will go through into the X-ray tube, and the table will continue moving.
The benefits of CT scan. 1. CT eliminates the superimposition of images of structures outside area of interest. Inherent high contrast resolution of CT enhances differences between tissues that differ in physical density by less than 1% such that they can be distinguished. 2. CT scans have greater image resolution, enabling examination of finer details. CT can distinguish between tissues that differ in radiographic density by 1% or less. 3. CT scanning enables multiplanar reformatted imaging, which is scan data can be visualized in the transverse or axial, coronal, or sagittal plane depending on the diagnostic task. The comparison of CT scan with simple X-ray and magnetic resonance imaging (MRI). CT scan and MRI create 3D images while simple X-ray create 2D images. CT scan used primarily to diagnose conditions in organs and soft tissues. Simple X-ray used primarily to see bones and to detect cancer and pneumonia. MRI used primarily to scan the spine, brain, breast, muscles, abdomen, and neck. The advantage of CT scan is more powerful than X-ray, while simple X-ray is most common and widely available. The advantage of MRI is use a powerful magnet and radio waves. CT scan take a 360-degree image, while simple X-ray use radiation to produce images and MRI create cross-section images. In conclusion, we have analyzed that computed tomography or CT scan is one of the most important spectroscopy in medical industries. It has been proven by the effectiveness to create an image in order to see the whole body of human structure, or others by using the narrow beams. In other part, this application has been used from 1917 with a revolution even has a minor effects in long-term use. We can conclude that CT scan has made a major impact on the practice of dentistry, diagnosis, surgery, and other parts. It is clearly helpful with advances in computer softwares already allow 3D visualization images.
Okay, that's all from us. Thank you.